The Senior Rehab Project is supported by the Game Changers, a group of motivated rehab clinicians that are crushing mediocrity and advancing care for older adults. You can join this group of people and get access to the private Facebook group, the monthly meetup with article discussions, and have a say in the direction of this movement. Get off the sidelines and get involved. Just go to seniorrehabproject.com/Game Changers. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults. And now your host, my grandson, Dusty Jones.
Hello, friends. Welcome to the Senior Rehab Podcast. This is your host, Dustin Jones. Good to talk with you. Just want to mention one announcement before we get into this Game Changers episode. We're changing our schedule. So the Senior Rehab Project, we've been cranking out content 3 times a week for months on end. It is a lot of information. We hope you're finding it helpful. I know it's been helpful for me to listen to the rest of the team get on the horn. But I've recently transitioned from driving around Lexington, Kentucky to see my patients to going just to one facility. So, I'm commuting 15 minutes to one building and then coming home at the end of the day. So my podcast listening time has been cut dramatically. And I can't even keep up with the episodes that we are producing at SRP. And I imagine a lot of you all feel the same way. You may have a shorter commute or you're not doing something like home health. And that's just tough. It's just a lot of content. So you may be missing a lot or it may be overwhelming. So we're going to be trimming things down a little bit, not too much, but we want to really focus on keeping things succinct. So not having too long of episodes, keep it, roughly that 20, 30-minute time frame or even shorter sometimes. But here's the schedule that we're going with going forward. So Mondays, you're going to get an episode every Monday. So the first Monday of every month is Troy Mead with HH Recharge. The second Monday of every month is Nicole Nexon with the State of the Sniff. The third Monday of every month is going to be Alyssa Kuhn with the Old Not Weak segment. The fourth Monday of every month is going to be the Game Changers meetup where we discuss pertinent articles. And then on Wednesdays, Tali and Aaron are going to go to Wednesdays, and they're going to go to every other Wednesday where they're going to drop their SR Prereqs episode. So that's how we're going to do the Mondays and Wednesdays. We're still going to be releasing the PT on Ice episodes every Friday with me and Christina. But that's what you can expect. So some weeks will be 3 episodes, some weeks will be 2, but overall, we're going to try and just kind of tighten things up, and, provide you with high quality content. So today's episode is a Game Changers meetup. The Game Changers are those motivated clinicians that support what we are doing here at SRP. They pay $8.99 a month to be a part of this group. They get a redefined old mug, which you can't find anywhere else. They are a part of a private Facebook group, and they get access to this meetup where we discuss a pertinent article, talk about how it is applicable to our work, we critique it, and just have a pretty fun conversation. Those people keep the lights on at SRP. We are very grateful for what they do, but you don't have to become a game changer to support the work that we're doing. You can just, give $1 a month, and that's going to be so helpful to pay for our software, some equipment that we use, and also the time that we all put into this podcast. So we use a platform called Patreon. So Patreon is how you can support creatives. So people that make music, that make podcasts, anything that basically you can create, digital content that you create online, you can support them directly, which is very helpful for them to keep doing what they're doing. We use Patreon as well, so for as little as $1 a month, you can support SRP, or you can give up to $8.99 a month and become a game changer. So to find out more information about all that fun stuff, just go to seniorrehabproject.com/join, and you'll find all that information. And we hope you'd consider supporting us. We greatly appreciate it. So this month's episode, the Game Changers meetup, is on Dementia and Physical Activity, a trial of moderate to high intensity exercise training for people with dementia, a randomized controlled trial. You may have seen this article make some ripples. It was featured in the Telegraph and the Guardian, and I think Al Jazeera. I think Huffington Post did something on it. Several, global outlets discussed how the findings of the study showed that exercise can make dementia worse. It can make cognition decline. So we wanted to read this article and just kind of discuss it a little bit. I'm going to read the abstract right now. A link to this abstract will be in the show notes as well. So the objective portion: to estimate the effect of a moderate to high intensity aerobic and strength exercise training program on cognitive impairment and other outcomes in people with mild to moderate dementia. The design, it was a multi-center, pragmatic, investigator-masked, randomized controlled trial. The setting was a National Health Service primary care, community, and memory services, dementia research registers, and voluntary sector providers in 15 English regions, so in the UK. The participants, 494 people with dementia, 329 were assigned to an aerobic and strength exercise program, and 165 were assigned to usual care. Random allocation was 2-to-1 in favor of the exercise arm. The intervention was usual care plus 4 months of supervised exercise and support for ongoing physical activity, or usual care only. Interventions were delivered in community gym facilities and NHS premises. So the outcome measures: the primary outcome was score on the Alzheimer's disease assessment scale, cognitive subscale, at 12 months. Secondary outcomes included activities of daily living, neuropsychiatric symptoms, health-related quality of life, and career or care quality of life and burden. Physical fitness was, including the 6-minute walk test, was measured in the exercise arm during the intervention. So the results, lots of numbers, probably not great to read, but basically their conclusion was a moderate to high intensity aerobic and strength exercise training program does not slow cognitive impairment in people with mild to moderate dementia. The exercise training program improved physical fitness, but there were no noticeable improvements in other clinical outcomes. And they had a nice little summary table that says what is already known on this topic. The role of exercise in slowing cognitive decline in people with dementia is uncertain. There is a paucity of randomized controlled trials of sufficient size and methodological quality to inform practice. Guys, my vocabulary is pretty weak. And the next part says, what this study adds: people with mild to moderate dementia can engage and comply with moderate to high intensity aerobic and strengthening exercise and improve physical fitness. These benefits do not, however, translate into improvements in cognitive impairment, activities in daily living, behavior, or health-related quality of life. The exercise program might possibly have worsened cognitive impairment. And that's what the Telegraph and Guardian and all those different articles really latched onto. So without further ado, let's get into this Game Changers monthly meetup on this lovely article about dementia and physical activity. Hello, friends. Welcome to the Senior Rehab Podcast. I've got some awesome people with me right now. Dale Avers up in Syracuse, New York, and Joanna, who's pretty close to Dale, right, in Ithaca on the lake.
Yep.
Seems like a lovely place.
30 minutes.
We have Martin as well. I think Martin may be having some audio difficulties, but Martin's with us too. So we, and I'll read the abstract for everyone, but we just talked about dementia and physical activity, trial of moderate to high intensity exercise training for people with dementia, randomized controlled trial. So I had a good discussion, but we'll just talk about just our general thoughts on this. And the good, the bad, the ugly. For the listeners that aren't necessarily aware of this paper, this is the paper. If you're in the SRP Facebook group, or if you're active on Twitter in the PT world, this is an article that went around on the Telegraph, on the Guardian, on Al Jazeera, several kind of global media fronts, talking about how exercise can make dementia worse. This is based on this study from some of the findings that they found. So as you can imagine, when you actually read the article, it doesn't necessarily portray that image as dramatic as what the news outlets did. But let's just talk about a few things that we brought up. But let's talk, I think the big point was just kind of the intervention that they use, the exercise regimen. So Joanna, do you want to talk to just kind of your thoughts or critique on the particular exercise that they picked?
Yeah. So my thought when I was reading the paper just about the exercise protocol was that it was just like incredibly simplistic and just repetitive, like 3 sets of 20 of just front and lateral arm raises, and I was wondering whether those exercises, if there was any benefit to exercises that would have had cognitive challenge rather than just like repetitive unidirectional exercises. And then I was also curious about the length, the duration of the program, and it being only twice a week for 3 to 4 months. So those were my first thoughts about the program.
Yeah. I know Meg Lowry in Australia, when she listens to this, she's going to be pumping her fists in the air saying, yeah, Joanna, add that cognitive challenge to exercise. Dale, what were your thoughts on kind of the intensity and length?
Yeah, I think in reading the protocol paper that preceded this, that the intensity was based on an RPE, which I question how reliable and feasible that is with people with cognitive issues. So that's one. The second was kind of as a reinforcement of that, the intensity was questionable from a sit to stand perspective. So while they seem to talk a good tale, if you look further about sit to stands, they didn't mention whether or not it was with arms or not. So I'm always suspicious of that. And sure enough, in the protocol, they kind of had 3 categories. One was no use of hands, but the fair and poor categories were use of hands. And they may have added a weight vest to that, but that wouldn't have meant necessarily the legs were being used. Maybe the arms were taking that weight off. So that was kind of an issue, is kind of the intensity. And while the volume looked good with 20 reps, you have to wonder if somebody can do 20 reps, what the intensity is, right? And so that might be 40% of an RM if they can do 20. And so again, you kind of wonder how much intensity it really is. And I think that the studies on dementia have shown that you need to have moderate to high intensity to really see a difference, to really fire that BDNF. And so I'm kind of questioning whether or not that intensity occurred in this study.
Yeah. And you mentioned before, just a lot of studies that do show any change in cognition are typically, longer. The intervention,
right,
at least 12 months or so.
Yeah, I think they're close to 12 months. Yeah.
Yeah. They mentioned in the paper just some of the equipment that they used, and I do want to bring light to that because I think that would be helpful for a lot of listeners. We talk a lot about weighted squats or sit to stands, and there's so many different ways that we can load it. Weighted vest or weighted belt or waist belt is definitely an option. It can be tough to find a good weighted vest that is going to fit an individual, but it's also you can change the weight incrementally. And they used an all-pro exercise weighted vest. I'll try and put a link in the show notes. But this looks like a pretty sleek vest, not too much fabric, and you can add weights, take weights away. It looks a lot better than the one I'm currently using for sure, which mine's just super clunky and it's just tough to lug around. But this one looked pretty solid. Don't have my hands on it yet, but it is rather intriguing. Then they used a weight or a waist belt as well, but I wasn't able to find that. But if you all are thinking, how can I load, people with that type of movement pattern, a weighted vest or waist belt can be helpful. And they looks to be like a pretty solid one in this paper.
Right. Right.
Okay. What else? And then kind of the discussion, what they said at the end in terms of what they can recommend or cannot recommend. Any thoughts on what they said?
Well, I thought the statements were a little loaded and far-reaching for one small differences as they showed. I mean, it wasn't like it was absolutely clear that these folks got worse. So when they say moderate to high intensity aerobic and strength exercise cannot be recommended as a treatment option for cognitive impairment and dementia. I kind of question that. Earlier on, they said may not be recommended, but in the end, they actually kind of stomp on it with both feet. I think that's a little premature.
Yeah. Yeah. So all in all, I mean, that's kind of all we got. I mean, it, like Dale said, just it's a pretty solid study. There were some weaknesses that we discussed, but I think the big lesson here for us that we talked about is, my gosh, it's amazing to see how media outlets can take a study even like this with these results that, you know, are not necessarily, you know, clinically significant and just blow it way out of proportion.
Right.
It was just,
right,
it was just
right.
really fascinating to see. And I'll try and post some links for
credit exercise.
Yeah. Just, it was crazy. And I'll put some links in the show notes to some of these articles from the Guardian and Telegraph and whatnot. So, but yeah, that's it. I appreciate y'all.
Sure. Thanks for finding this article. That's awesome.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.